So we have everyone back. Now we're going to get into a little bit more about specific activities you can do with veterans, treatment planning, how to incorporate animals into a counseling situation. So we're going to start with an example. Joan is a 29-year-old veteran having served 3 terms in Iraq. She left the military with a medical discharge after receiving shrapnel in her leg. She was a captain at the time of her discharge. Joan is married and has 2 children. Her husband is a retired veteran as well, but does not complain of any problems. Joan presents with anxiety attacks when going into public and has started to stay at home most days. She complains that her husband does not understand her problems and feels hurt by his lack of support. Joan has not yet found a job, and the family has 1 pit bull and 1 cat. So in your folders, you will see a treatment planning form. Go ahead and pull that out and try to think of 3 short-term goals and 3 long-term goals for Joan. And these don't necessarily have to include an animal, but they can if that's what occurs to you. But these are just more general goals that you might think about when Joan presents to you. We'll take a couple minutes to do that. Is it this one? Yep.
It's rolling. You're going to be a couple minutes with this? Or?
Yeah, like, give people a couple of 3 to 5 minutes.
Just let it run.
Okay. Okay, about 2 more minutes. Yes. She has a pit bull and a cat. Yep. All right, another minute just to think about, at least if you can get at least 1 short-term goal and 1 long-term goal, hopefully more, but at least 1 for each would be good. Alright, does anyone have one they'd like to share? Let's start with short-term goals. So what might be a short-term goal that you think might be helpful for Joan?
Supportive counseling related to adjustment to her injury.
Okay, so adjustment to her new injury. So the shrapnel. Yeah, Chris.
Learn some tools to cope with her anxiety attack.
Okay, yep. And Melissa?
I was going to say, explore the source of her anxiety.
Okay. Did any of you think about what specific interventions you might use to achieve those goals? And if not, that's fine. Okay, John?
In the office, giving exercises of giving the attention of the dog and bringing that animal onto her lap, with the head or something, and petting.
Okay.
And then practicing that at home with her animal as well.
Yeah. So either her dog or her cat. Yeah. Great. Yeah.
I thought since she's having problems leaving her apartment, to start out with her dog at home, just with small walks, especially to feel safe and protected with the dog.
Yeah, that's a great idea.
That's what I was
Great minds think alike. All right, what about long-term goals? Yeah, Chris.
Establish a bond with your husband.
Okay. Yeah, so maybe even reestablishing existing experiences, yeah. And,
helping her get connected to the community.
okay. Yeah, so outside support besides her family.
Oh, yeah.
Sorry.
No, that's me, I said, same.
Okay. Yeah, Melissa.
I was just gonna add that I think that, I don't know if it'd be in the short or long-term goals, but when she's walking with her dog, I think it's important that her husband goes along with her. If they're having trouble connecting, it might be a good time for them to be outside of the situation and talk and have a mutual kind of purpose going towards it.
Yeah, and I think that would meet a lot of goals. You know, it's not just connecting with their husband, but it's getting out of the house, it's establishing maybe social support, you know, maybe going to a dog park and meeting other dog owners. You know, I think that activity can serve a lot of purposes for her. Yeah,
And
John.
all these activities may have to be in phases. First you initiate the animal, then you do the walking, then you do the walking with the husband.
Yeah.
But yeah,
So sort of that scaffolding or sort of systematically increasing, you know, what she does each time.
Keeping in mind kind of the physical implications of all the walking on her leg. So there may be some restrictions there.
That's a really good point.
that
Yeah.
was good.
Yeah, because we forget about the fact that she got shrapnel, so maybe these walks that we have these great ideas aren't going to be so pleasant for her after all. So what might be another long-term goal? Shirley, did you have something?
I just thought about using the metaphor as the dog and cat and the differences that they may have in relation to her and her husband, having differences in the way that they cope with their experiences.
Okay, great. What about, does anyone else have another long-term goal that they wrote down for?
Employment.
What's that?
Employment.
Employment, that's a great one. Yeah, Melissa.
I put, helping her find a sense of purpose and fitting in.
All right, so this is sort of a sample treatment plan that we might do with some of our veterans and even some of our other clients. But we talked a little bit about that with, you know, what animals she might use at home, but these, or work with at home. These are some of the animals that we work with here or that we've, you know, heard about as being involved in animal-assisted therapy. So here, as you've seen, we have dogs and cats. We have horses and goats. Rabbits can also be incorporated into therapy settings. Linda's daughters preschool used to have a rabbit that, or they got another one? They have two rabbits now. So rabbits can be really nice. Birds and fish, you might not interact with them quite as much as you might with a dog or a cat, but they can be therapeutic. Fish can be therapeutic, just in watching them can decrease heart rate and blood pressure. So, you know, if Joan didn't have a dog and a cat, but she had a fish tank, you know, maybe she could watch the fish tank to help her relax. We knew someone who had a ferret, a therapy ferret. Guinea pigs you can incorporate as well. Rats, we have 2 rats in our basement that are pretty awesome. And then, can you guys think of any other animals that might be incorporated? Yeah.
I had this experience when I went to China. People that have birds in cages you think you can't interact, they used to take their bird cages to the park and hang them in a tree. And other people would too. And the birds could communicate, but it was amazing how it got to people. This is mainly, it was elderly people.
Yeah.
And they would sit and discuss their birds. And it was like something I've always kept in the back of my mind for someone that doesn't have a pet but has birds. It's like,
Yeah.
you could take the whole cage outside and hang it up in a tree.
Yeah, that's a good point.
Yeah.
Or
Isn't that cool?
Yeah, and parrots are also
Like to
really
find
smart.
this, you can just hook it onto, or do they have to somehow figure out how to get on the
I
tree?
think you just bring a hook with you.
That's interesting.
Yeah.
Linda.
I met somebody recently who had therapy cockroaches.
Oh, Linda, no.
So
I know, that was my reaction to
They're
it.
really big ones.
Really big ones.
Okay,
yeah.
so